Hello, and welcome to our presentation. This is Maintaining Nutrition in the Geriatric Population, presented by authors David Hayes, Kanisha McConnell, Maria Bowie, Sarah Dent, and Ben Liverman. As a person ages, the body goes through many changes, most of which have a negative effect on the lifestyle and health of the older population. Nutrition plays a vital role in mental, physical, and even social health. Food deficiencies have been shown to be a major factor in the general quality of life for the geriatric population. The research and implementation of practices that would combat these known deficits would be a benefit to all patients as they age. Let's take a look at a study assessing the prevalence of poor nutritional status among the elderly. This case study, conducted in 2021 on the Greek island of Crete, assesses 730 elders living in their homes. The study assesses the individual's nutritional status and places them into three categories: adequately nourished, at risk of malnutrition, and malnourished. The goal of the study was to provide data to most efficiently support elders in achieving successful aging. The case study highlights key factors contributing to poor nutrition among the 730 participants. The older the individual, the more malnourished they tended to be. Their partnership status affected their nutritional status as well. People divorced or widowed tended to have poorer nutrition than those who had a partner at home. The elderly population's needs are complex. This study utilized not just nutritional assessment tools, but also the Geriatric Depression Scale, the Mini Mental State Examination, as well as the Charlson Comorbidity Index, amongst others. To properly evaluate the well-being of the older adult, it is necessary to look at their nutrition in the context of the larger picture, which includes cognitive, mental, and physical health. Why does diet matter? Well, a better diet allows for overall better body function. Maintaining a healthier diet has shown improved biomarkers such as decreased C-reactive proteins leading to decreased inflammation, decreased total cholesterol, and increased good fat such as HDLs. People who try to control what they eat have fewer limitations in their ADLs and often seem to have a better mindset while doing so. The Healthy Eating Index is a tool that measures how balanced an individual's diet is. And the higher the score, the healthier and more balanced the diet is. A good way to be in control of the food you put in your body is by limiting the amount you are eating and by choosing plenty of proteins, fruits, veggies, fats, and whole grains. Even the smallest improvements in your diet can make the biggest impact in your aging health. Mental health is a major contributing factor in the nutritional status of older adults. Conditions like depression and dementia can directly impact how older adults eat and therefore their nutritional status. According to recent research, a high percentage of older adults are either malnourished or at risk for malnourishment, especially those experiencing mental health issues. This study found that older adults with mental health issues were more likely to have poor nutritional status compared to those without. This relationship can happen for several reasons. Depression can reduce appetite and motivation to eat, while cognitive decline like dementia can make it difficult to plan meals, remember to eat, or even physically manage food. As a result, decreased food intake becomes a major contributing factor to malnutrition. Over time, this can lead to serious health consequences, including weakened immunity, decreased mobility, and increased risk of mortality. The study highlights that older adults with cognitive decline and/or mental health issues are 22 times more at risk for nutritional issues. This study emphasizes the importance of addressing both mental health and nutrition together when caring for older adults, rather than treating them as separate issues. One option for improving nutrition in the older adult is introducing nutritional supplements to a balanced diet. A 2023 study found nutritional supplement drinks to be a valuable intervention in improving nutrition status in the older adult. The study found marked improvements in BMI, nutritional status scores, and quality of life surveys in those surveyed after 3 months of integrating nutritional supplement drinks into their diet. They even found that these older adults had improved walking speed at the end of the study. Another benefit of these drinks is that they don't require chewing, and as such may be appropriate for the older adult struggling with dysphagia or difficulty swallowing. Nutritional supplement drinks are available in a variety of flavors to suit the preference of the individual diet. Considerations for nutritional health in the older adult have a significant impact on nursing practice. Nurses should ensure that their patients are receiving quality nutritional assessments. Nurses can also help to ensure that patients are receiving daily or weekly weights, that registered dietitians are included in interdisciplinary team care. They can help promote healthy eating with their patients by promoting smaller meals throughout the day, and help enforce implementation of nutritional supplements in the patient's diet. As individuals age, maintaining proper nutrition becomes increasingly complex, being influenced by a multitude of behavioral, psychological, and social factors. Behavioral health issues such as depression, anxiety, dementia, and psychological distress profoundly affect appetite and nutritional intake, often leading to malnutrition, weight loss, and declining health. The consequences of malnutrition in older patients include increased risks of wound infections, acute confusion, and falls, as well as higher mortality rates. Eating and nutrition contribute to health and recovery. Some interventions to improve older adult nutrition have already been covered in this presentation. However, the specific ways of addressing this, such as weighing patients and conducting risk assessments, or the nurse role, is lacking. Studies have shown that an older adult's nutrition status in hospitals is influenced not just by how hungry they may be, but also by interactions among nurses, staff, and other providers. But the question of how to support nurses in nutrition-related care and which nursing interventions would be effective in hospitalized older adults seems to be missing. Research has shown that a new approach referred to as Eat Enough will result in changed behavior and nutrition-enhancing attitude amongst nurses. Among other changes in action, the nursing staff will take primary responsibility for older adults' nutrition in hospitals, while being educated by dietitians. By doing this, older adults' self-care abilities could be improved, or at least maintained, and the recovery times can be noticeably reduced. From a management and accounting perspective, if implemented successfully, Eat Enough's reduction in recovery times would reduce hospital stay times, reduce readmittance and complication rates, which could increase cost recovery, in turn saving the facility money in the end. Behavior change occurs in 5 stages: pre-contemplation, not knowing or thinking about a problem; contemplation, considering there might be an issue; preparation, setting oneself up to tackle a problem; action, taking steps to correct the issue; finally, maintenance. Change takes time. This step requires that changes be maintained and evaluated for efficacy over time. Change was the basis for the research behind Eat Enough. This foundation was needed to change the attitude of the professionals so they could enhance their overall care of their patients. The change needs to come from within the nursing culture, as this culture has an essential impact on whether nurses conduct a thorough assessment to recognize nutritional problems and whether nurses are present and deliver support during mealtimes. Suggested changes include education, case analysis, and regular audits to allow input from the nurses working in direct patient care. Another activity within the process of change is ensuring the flow of information within the interprofessional healthcare team, which is accomplished through weekly updates of nutritional status and nutrition-related treatment goals at interprofessional meetings. These changes were studied in small groups in a hospital setting and were found to lead to increased knowledge and improved adherence to service standards in the interprofessional team. Eat Enough is a comprehensive intervention that seeks to enhance nutrition in older, hospitalized adults by incorporating not just the patient's actions, but the attitude and actions of the care providers as well. Nutrition plays a critical role in the health and quality of life in older adults. Nutritional deficiencies increase the risk of chronic disease, functional decline, and loss of independence. there is also a strong connection between mental health and nutrition, with each influencing the other. Our research showed that nursing interventions, such as education and nutritional support, can significantly improve outcomes in the older adult. Overall, early assessing and intervention of nutrition and holistic care are essential in preventing malnutrition and promoting healthy aging.